When should an atypical mole requiring a biopsy? Have you ever noticed a mole on your skin that looks a little different from the others? Maybe it's larger, oddly shaped, or changing over time? These are important signs to pay attention to. When it comes to atypical moles, or what doctors call dysplastic nevi, knowing when to get a biopsy can be life-saving. An atypical mole should be biopsied if it shows features that raise concern for melanoma, which is the most serious type of skin cancer. The key clues are often summarized by the ABCDEs: asymmetry, border irregularity, color variation, diameter larger than 6 millimeters, and evolution or change over time. If a mole is asymmetrical, with uneven borders or multiple colors, or if it's growing or changing, it's time to see a healthcare professional. Biopsy is especially important if the mole is new or has recently changed in size, shape, or color. These changes can be signs that something more serious might be developing. The preferred method is an excisional biopsy, which involves removing the entire mole. This allows the pathologist to examine all parts of the lesion under a microscope, making sure no cancer cells are missed. Partial biopsies, like shave or punch biopsies, may be used if the mole is large or difficult to remove completely, but they are less ideal for diagnosis because they might miss areas of concern within the mole. The level of atypia, or how abnormal the cells look, also guides the decision. Moles that are moderately or severely atypical carry a higher risk of turning into melanoma. These often need complete removal and close follow-up. If the biopsy shows only mild atypia and the margins are clear, doctors might choose to monitor the mole instead of removing it immediately. Size matters too. Large atypical moles can be tricky to remove entirely, so sometimes a smaller part is biopsied first. But when possible, complete excision is best for accurate diagnosis. People with many atypical moles or a personal or family history of melanoma should be especially vigilant. They should have suspicious moles biopsied promptly and undergo regular skin checks. Dermoscopy, a technique where doctors look at the mole with a special magnifying device, helps identify suspicious features but cannot definitively diagnose melanoma. If a mole looks worrisome under dermoscopy, a biopsy is usually recommended. In summary, any atypical mole that is new, changing, or shows features like irregular borders, multiple colors, or larger size should be biopsied. The goal is to catch melanoma early and ensure the best possible outcome. Remember, individual risk factors vary, so always consult a dermatologist or healthcare provider for personalized advice. Regular skin self-examinations and professional evaluations are key to maintaining healthy skin and catching problems early.